रिक्वेस्ट की थी
Recording
कि
in
डॉक्टर फरहत
progress.
आना चाह रहे हैं ऑनलाइन। वो
कौन
कहीं
सा?
कराची। डॉक्टर फरहत है, एचएमसी के जो टीम मेंबर है।
अच्छा, फरहतुल्लाह फरहत।
हाँ, वो ऑनलाइन आना चाह रहे हैं, तो लेकिन वो फिर डिस्कस किया था।
Institute of Heart Diseases, and he joined us from UK currently. Welcome, sir. Dr. Tariq Farman, he is chairman of cardiology department in Dow University of Health Sciences, Karachi. He will join us shortly as well. So I will move towards the PIC Warriors first. PIC Warriors, please give your introduction, your captain name, and your team member's name, please.
Assalamu alaikum, sir. Captain Dr. Noman Munir Khan, resident cardiologist, Peshawar Institute of Cardiology.
And your team member, please.
My team on my left side is Dr. Wali. He is a trainee. And on my right side is Dr. Haider Ali. He is also TMO cardiology.
Thank you very much. With this introduction, we will move to HMC Stallions. Please give your introduction, please. HMC Stallions.
My name is Dr. Muhammad Tufail Jan, Captain Hayathabad Medical Complex, Peshawar. To my right is Dr. Irfan, and to my left is Dr. Ihtisam Saeed.
Thank you very much. Thank you very much, Dr. Saab. And now, Hamza, we will move towards the coin toss, and PIC Warriors will call the coin. So, PIC Warriors, you want to choose head or tail? Please let us know.
Head.
Okay, Hamza, please toss the coin. Flip the coin, please. Okay, so it's tail. It means that PIC Warriors win the toss. So PIC Warriors, just let us know you want to bet first. It means that you want to answer the questions, or you want to ball first. It means that you want to throw the questions first.
So first we want to ask question.
Yes, PIC Warriors.
Okay, so we will ask questions, sir.
Okay, so you want to ball first, huh?
Yes, sir. Yes.
Okay, so HMC Stallions, are you ready for bet?
Yes.
Okay, so PIC Warriors, please start your first over. Over to you.
Thank you. Okay, so scenario is a 64-year-old man with a history of alcohol dependency presented to emergency room with increasing dyspnea, chronic cough, hemoptysis, and persistent fever. Echo confirmed the presence of large pericardial effusion. Simultaneous right atrial pressure and pericardial opening pressure are shown in the figure below.
Okay, your figure is not really clear. So you have to tell us the pressures as well, please, because the markings are not very clear.
Yes, markings are not clear, sir.
Yes, so can you tell us what are the pressures are? The right arterial pressure and pericardial opening pressure, please.
It's not clear, sir.
Yes, that's what I'm saying. So PIC Warriors, please, you have to help us and tell the pressures, please. PIC Warriors.
Picture is not clear. Listening.
Okay, I realize that PIC Warriors, you did not make these questions. Is it true?
Yes,
Sir,
sir.
we are zooming it.
That's why you are struggling, huh?
I think, sir, it was
We are
decided
zooming
that
it.
question will be prepared by the.
Okay, Hamza, can you zoom it, please? Hamza, can you zoom? We cannot share
Yes, yes,
the...
we are zooming it.
Okay, now it's clear, okay?
Yes, sir.
Okay, PIC HMC Stallions, when you're ready, we will move. So please let us know when you're ready.
Okay, let us move.
Okay, please move to question number 1. Hamza, please move to question number 1. Okay.
Okay, so question number 1 is regarding this hemodynamic tracing, which of the following statement is incorrect? So should
please.
I?
Yes, you have to read the stems as
Options
well.
too. Okay.
Yes.
So option A is the X descent during ventricular systole is the dominant waveform. Option B, right atrial and pericardial pressure fall during inspiration. Option C, with increased pericardial fluid accumulation, X descent will become less prominent and Y descent more pronounced. Option D, RV mid-diastolic pressure may be elevated and equal to the right atrial and pericardial pressure. Option E, the patient can have muffled heart sound on auscultation.
Okay, PIC warriors, your time has started now.
In the muffled heart sound signal from down to the RV mid-diastolic pressure may be elevated. With these pericardial fluid accumulation, the position will be permanent and more down to the right atrial.
This format is okay. Then you can target.
Constrictive pericarditis.
Okay, 40 seconds left. Stallions, 40 seconds left.
Option B, the right atrial and pericardial pressure fall during inspiration.
Okay, are you sure we should lock B?
Yes, sir.
Okay, thumbs up, please lock B. Please lock answer B. Oh, it's a wrong question. No problem. It's still you have 9 questions, lot of overs left. So we'll move towards question number 2. Warriors, please ask the next question.
Question number 2. All of the following statements about constrictive pericarditis are true, except invasive right heart catheterization is essential prior to pericardectomy. Option B, chest CT scan has highest sensitivity to detect pericardial calcification. Option C, TTE is a good early test. Option D, constrictive pericarditis is a progressive disease and requires early pericardectomy. Option E, late gadolinium enhancement on cardiac MRI and elevated inflammatory markers have been suggested as predictive marker for reversibility.
Okay, Stallions, your time starts now.
Chest CT scan has highest sensitivity. Transfer and requires elevated remarks have been suggested as marker of possibility.
Okay, Stallions, 50 seconds left. Okay, 30 seconds left, Stallions.
Option E, late gadolinium enhancement at cardiac MRI and elevated inflammatory markers have been suggested as.
Okay. So are you sure? Answer.
Yes, sir.
Answer. Okay. Hamza, please lock answer E. Okay. Sorry, it was answer D and it's okay. We'll move towards question number 3. Please, warriors, ask question number 3.
Okay, so question number 3. Which of the following catheterization findings most reliably support a diagnosis of pericardial constriction or restrictive cardiomyopathy? Option A, pulmonary artery pressure. systolic pressure. Option B, a prominent Y descent. Option C, equalization of right and left heart led diastolic pressure. Option D, ventricular interdependence. Option E, biatrial enlargement.
Okay, Stallions, your time has started now.
Sir, it's option D, ventricular interdependence.
Ventricular. You have a lot of time left. Are you sure we should lock this?
Yes, sir.
Okay, so with the permission of Stallions, we will stop the timer and lock option number D. Please lock Hamza option number D. Very good, Stallions, very good, fantastic. So with this, you have started your score, and we'll move to question number 4 now.
So question number 4.
Yes, warriors.
During the development of pericardial effusion, progressive accumulation of fluid into the pericardial sac can cause equal elevation of pericardial and right and left atrial pressure. Which of the following is the initial hemodynamic and physical examination finding that can occur? Option A, hemodynamic collapse and shock. Option B, decline in cardiac output and hyperventilation. Option C, decrease in stroke volume and tachycardia. Option D, systemic hypotension and 𝐂𝐚𝐫𝐚 sign. Option E, arterial pulses paradoxes and rail.
Okay, Stallions, your time starts now. Okay, now 40 seconds left, Stallions.
Option D, systemic hypotension and 𝐂𝐚𝐫𝐚 sign.
Are you sure you still have 30 seconds left, Stallions?
Yes, sir. Sure, sir.
Okay, so we will log the option D, systemic hypertension and 𝐒𝐚𝐫𝐚 sign. Please log option number D. Thumbs up. Oh. Okay, no worries. No worries. You still have a lot of questions available. Okay, and you are doing great. No issue in that. So we'll move to question number 5. And good luck, Stallions. Please, warriors, ask question number 5.
Question number 5. Pericardial tamponade in the absence of pulsus paradoxes is described with the all of the following except option A, aortic regurgitation. Option B, severe rheumatoid spondylitis. Option C, constructive pericarditis. Option D, large atrial septal defect. Option E, aortic dissection.
Okay, Stallions, your time starts now. Okay, Stallions, you are doing really good. It's now 47 seconds left.
Large
30 seconds left, Stallions. Okay, now 12 seconds left, stallions. Last 10 seconds.
Option B, severe rheumatoid spondylitis.
Okay, we'll lock option number B. Please lock option number B. Hamza, please lock. Oh. Okay. Okay, it's a wrong answer, but anyway, still have plenty of questions left. So we'll move with this to question number 6. Warriors, please ask question number 6.
So question number 6. Mycobacterium tuberculosis was found in the same patient's pericardial fluid. Which of the following statement regarding tuberculous pericarditis is incorrect? Option A, pericardial constriction occurs in 10% to 15% of cases. Option B, mortality rate approaches 85% in untreated cases. Option C, a rapid diagnosis can be made from the small volume fluid sample by PCR, polymerase chain reaction. Option D, tuberculin skin test is falsely negative in 25 to 30% of the cases. Option E, concomitant use of corticosteroid is favored when there is either constrictive tuberculous pericarditis.
Okay, stallions, your time starts now.
See the diagnosis can be made from small volume PCR. Tuberculin test to be found immediately.
Okay, stallions, 50 seconds left. Okay, last 30 seconds left, stallions.
Option A, pericardial constriction occurs in 10 to 15% of the cases.
Okay, should we lock it?
Yes, sir.
Stallions. Okay, well, lock the answer A. Hamza, please lock the answer A. Very good, very good. Very good. Okay, so with this, we will move to question number 7.
Okay, so question number 7. Colchicine in the setting of acute pericarditis is contraindicated in which of the following underlying etiology? Post-cardiac injury, option B, post-CABG surgery, option C, malignancy, option D, viral pericarditis, option E, autoimmune disease.
Okay, stallions, your time starts now. Yes, stallions, take your time, relax, and then answer the questions. You're doing great. Now 40 seconds left, stallions. 30 seconds left. Stallions, last 15 seconds left.
Option E, autoimmune diseases.
Okay, we'll hold here and we'll mark option number E, please. Lock option E, Hamza. Oh. Okay, bad luck and better luck next time, Stallions. And with this, Warriors, please ask your question number 8.
So question number 8. All of the following trials have shown the efficacy of colchicine in acute pericarditis except ICAP, option B, CORP, option C, COPS, option D, COLCOT, option E, COP2.
Okay, your time starts now, Stallions.
Option D, COLCOT.
Are you sure? Because you have a lot of time left. Please.
Yes, sir. Yes, sir. Option D.
Okay, should we lock it?
Yes, sir.
Okay. Okay, we'll go ahead and lock option number D. Please lock on the option number D. Very good, very good, very good. Fantastic. So with this, we will move to our second last over, or you can say question. So Warriors, please ask question number 9.
Question number 9. Which of the following statement with regards to pericardial effusion in patient with systemic autoimmune disease is false? Option A. Pericardium may be involved in different systemic autoimmune disease. Option B. Pericardial involvement may occur either in a symptomatic form, usually during acute phase of disease, or is asymptomatic pericardial effusion. Option C. Pericardial effusion is a common manifestation of rheumatoid arthritis. Option D. Elevated rheumatoid factor is present in rheumatoid pericardial effusion. Option E. A low glucose concentration is typically present in patients with rheumatoid.
Okay, your time starts now, Stallions.
Rheumatoid glucose will come. What's the reason? So bacteria comes to chicken.
No, see where it is.
Rheumatoid
No, without common manifestation, only better enough manifestation. Pericardial effusion is a common manifestation of rheumatoid arthritis.
Oh.
Typically present in a patient with rheumatoid.
Yes, Stallions, take your time, relax, and then answer the question. Still, we have 45 seconds left.
Option E. A low glucose concentration is typically present in the patient with rheumatoid.
We still have 30 seconds left. If you want to think again, or should we lock the question answer number option number E? Please let us know. Yes, Stallions, please. 15 seconds left.
Option E. A low glucose concentration
Okay.
is
Okay, we will lock option number E. Hamza, please lock option number E. Oh. Okay, sorry, Stallions. It is not your day up till now, but hopefully for the last question, wish you good luck for the final question. Warriors, please ask the final question.
So question number 10. All of the following are appropriate in the management of TRAPS, which is tumor necrosis factor, recurrent acute pericarditis syndrome, except option A, higher dose and longer duration of NSAIDs, option B, higher dose and longer duration of colchicine, option C, steroids, option D, etanercept, option E, combination of NSAIDs and steroids.
Okay, Stallions, your time starts now. So it's a final questions for you, stallions. Take your time and do your best as whatever you can. Okay, 50 seconds left.
Option A, higher doses and longer duration of NSAIDs.
Okay, it says still 40 seconds left. If you want to rethink, you have all the time. Or please let us know, we should log the answer A.
Sir, kindly log the answer.
58. Okay, Hamza, please log answer A, option A, please. Okay, so it's a wrong answer. With this, you end up with 18 points or score. Very good, very well done, HMC Stallions. And with this, our first inning is ended up. Yes. So this is the score now. You give the right or the correct answer of question number 3, 6, and 8. Okay. Now I have with me Dr. Tariq Farman. He is the head of the department at Dow University of Health Sciences in Karachi. I will move towards Dr. Tariq Farman to please give his valuable comments regarding the game up till now. Over to you, Dr. Tariq. Dr. Tariq, do you hear me? I think he is not there. Okay, then meanwhile, I will move towards Professor Isasa because he is with us. Sir, please give your valuable comments. So we'll move further.
Ashar, I think we'll give the comments at the end. Let's proceed with the second inning.
Okay, with the permission of because we already get already
comments
late now.
देंगे.
Okay, no problem, sir. So with this, warriors, are you ready to answer the questions, please?
Yes, sir.
Okay, so pad it up and we'll move towards the second inning. Please, stallions, ask your scenario and ask your questions. Okay, this is the scenario now. Please.
A 64-year-old diabetic male presents with 6-year history of chest pain radiating to left arm. ECG showed T-wave inversion in V3 to V6. His troponin levels were elevated and he was transferred to the cath lab for coronary angiogram. The nurse in the emergency department loaded the patient with aspirin 300 mg and ticagrelor 180 mg.
Okay, are you happy with it, warriors?
Yes, sir.
Okay, so we'll move towards question number 1. Please, Hamza, please show the question number 1.
Which of the following best describes the administration and activity of ticagrelor? Oral irreversible direct-acting P2A12 receptor antagonist, oral reversible direct-acting P2A12 receptor antagonist, oral irreversible indirect-acting P2A12 receptor antagonist, oral reversible indirect-acting P2A12 receptor antagonist.
Okay, warriors, your time starts now. I cannot see the warriors on here. Please bring them here.
Duration of action
Okay, now they are there.
So, sir, option D, sir.
Okay, you still have 50 seconds. Are you sure? We should lock option number D?
Yes, sir, option D, sir.
Okay, please, Hamza, lock option number D. Option D, please, lock. Hamza, lock option D, please. Oh, okay, no worried, guys. You have chances, so we'll move with question number 2. Stallions, please ask your question number 2.
In the platelet inhibition and protein patient outcomes plateau trial comparing ticagrelor to clopidogrel in the patient with an ACS, how did ticagrelor affect the rates of mortality and non-coronary artery bypass graft major bleeding? Decreased mortality, decreased non-cabbage bleeding, decreased mortality, increased non-cabbage
Yes,
bleeding,
please,
unchanged mortality.
Stallions, please just say option number A and B, please. Please mention the options as well.
Option A, decreased mortality, decreased non-cabbage bleeding. Option B, decreased mortality, increased non-cabbage bleeding. Option C, unchanged mortality, increased non-cabbage bleeding. Option D, unchanged mortality, decreased non-cabbage bleeding.
Okay, warriors, your time starts now.
B, option B, sir.
Okay, warriors, you are running very fast. Are you sure we should lock option number? What you said, B or D?
B.
Option B. Okay, okay. Should we lock option B, please?
Yes, sir.
Okay, Hamza, please lock option B. Decrease mortality and increase non-cabbage bleeding. Very good, fantastic. So you start with the 6er, and with this we'll move towards our third over, means our question number 3. Please, Stallions, ask question number 3.
Which of the following statement is true regarding ticagrelor and ritonavir drug-drug interaction? Ritonavir is a strong inducer of
Option number A. Yes, option number A, please.
Ritonavir is a potent inhibitor of CYP2C9. Ritonavir increases the bleeding risk when co-administered with ticagrelor. Ritonavir increases the risk of thrombosis. There is no potential drug-drug interaction.
Okay, with this will yes, warriors, your time starts now. Stallions, please mention the option as well, A, B, C, and then read out the option. Okay.
Okay. Okay.
Like inhibitors, then other options. Sir, we will go with option 3, sir. Option C.
Okay, so you still have 55 seconds left. Do you want me to lock the answer?
Yes, sir.
Okay, Hamza. They are really in hurry, so please lock the answer C. Please lock the answer C. Very good. You were absolutely right in your thinking and answer. Very good, fantastic. And with this, we'll move to over number 4. Please, Stallions, ask question number 4, please.
Which of the following patients should be cautious while taking ticagrelor? Patient with renal failure. Option B, patient with SA node dysfunction. Option C, patients with prior TIA. Option D, patients with weight less than 60 kg. Option E, patient with age more than 70 years.
Okay, your time starts now.
Wait. Sir, option E.
Option E. Okay, warriors, are you sure we should lock option E?
Yes, sir. Option E, sir.
Okay, Hamza, please stop here and lock option E. Oh, this is the wrong answer. Okay, you still have a lot of questions left in your pocket. So with this, Stallions, please ask your question number 5.
The patient is started on aspirin at 1 mg and ticagrelor 90 mg twice daily post drug-eluting stent implantation. By which mechanism does this combination prevent stent thrombosis? Option A, glycoprotein 2B3 receptor inhibitor and P2A12 receptor inhibition. Option B, protease activated receptor inhibition and P2A12 receptor inhibition. Option C, cyclooxygenase 1 inhibition and P2A12 receptor inhibition. Option D, cyclooxygenase 1 inhibition and protease activated receptor inhibition. Option E, cyclooxygenase 1 inhibition and enhanced adenosine phosphate secretion.
Okay, warriors, your time starts now.
Option C.
Oh, you are really in hurry. Are you sure? We should
Yes,
lock
sir.
the. Okay, with your permission, Hamza, please lock option C. Please lock option C. Okay, very good, fantastic. So I think so I think the points or the numbers are now equalized at this stage. Good luck both teams from here onwards, and we'll move to question number 6.
The patient was administered morphine for pain relief in the ER. What is the possible interaction
Of morphine.
with ticagrelor? Option A, the concomitant use of morphine can delay the absorption and maximal inhibition of ticagrelor. Option B, morphine can cause CYP3A4 inhibition and decrease elimination of ticagrelor. Option C, morphine is a CYP3A4 inducer and increase the metabolism of ticagrelor. Option D, it can increase the risk of bleeding when administered with ticagrelor. Option E, there is no drug interaction of morphine with ticagrelor.
Okay, your time starts now, warriors. Okay, warriors, 50 seconds left.
Option A, sir.
Okay, as I said, 50 seconds left. You have enough time. Are you sure? We should lock it?
Option A, sir.
Okay, with your permission, Hamza, please lock option number A. Please lock option number A. It looks very good, fantastic. Okay, so you already won the match, but I informed by my team that we should ask the whole 10 questions. So with this, warriors, congratulations, you won the game, but we will have to finish the game completely. So we'll move to the next question. Question number 7, yes.
Number
Please,
7.
yes.
Of the following characteristic accurately describe 𝐂𝐚𝐫. Small molecules ATP analog rapidly activated in serum. Option B, small molecule cyclic adenosine monophosphate analog rapidly activated in serum. Option C, small molecule ATP analog rapidly degraded in serum. Option D, small molecule 𝐶AMP analog rapidly degraded in the serum. And option E, large molecule that reversibly binds with ADP receptor.
Okay, your time starts now, warriors.
Rapidly degrading the serum. Short acting, there are three another seconds. The 7 वाला शेड है marvelous वाले 7 वाला शेड है receptor वाला बाउंड वाला मत याद दे दागा दे ADP receptor ने ADP P2Y12 ADP receptor
Okay, 50 seconds left, warriors.
Sir, option E.
Are you sure, warriors?
Yes, sir. Option E, sir.
You said option E, the last option.
Yes, sir.
Am I right?
Yes, sir.
Okay, we'll lock the option number E. Hamza, please lock option E. Oh, it's a wrong answer. Okay, no worries, no issue. You already, won the match. So with this, we'll move to question number 8, please. Stallions ask question number 8.
Relax.
In the ISAR REACT 5 trial, intracoronary stenting and antithrombotic regime, rapid early action for coronary treatment 5 trial, comparing the ticagrelor and prasugrel among the ACS patient undergoing PCI, which one of the following is correct? The primary endpoint of of a composite of death, MI, or stroke at 1 year was significantly higher with prasugrel compared with ticagrelor? Option B. There was significantly more bleeding in the ticagrelor group. Option C. The risk of major bleeding was significantly increased in the prasugrel group. Option D. The rate of MI was similar in two groups. Option E. The rate of MI was higher in the ticagrelor group.
Okay, your time starts now, warriors.
देखिए जो पॉइंट है मैं देखिए the primary endpoint show yeah more bleeding. More bleeding. Yes, with the no bleeding chances but like the option B there was significant more bleeding in heart at the station. Option E. Okay. Sir, we will go with option.
Yeah, you can't think twice. You still have 40 seconds left. Okay, warriors, 30 seconds left.
Sir, option C, sir.
Okay, should we lock option C?
Yes, sir, option C.
Okay, Hamza, please lock option C. Please. Oh, okay, no worries. No worries. You still have 2 questions left to make your points more. So with this, we'll move to question number 9. Yes, Stallions.
Based on the results of the Plato trial, ticagrelor versus clopidogrel in the patient with ACS, which of the following is correct? Option A, ticagrelor caused more strokes compared to clopidogrel. Option B, the rate of major bleeding was significantly higher with ticagrelor compared to clopidogrel. Option C, the rate of MI was similar in the two groups. Option D, there was mortality reduction seen with ticagrelor. Option E, the rate of MI was higher in the ticagrelor group.
Okay, with this, your time starts now, warriors.
Which of the following is the rate of the motility benefits is
reduction. Sir, option D, sir.
Option D. Okay, are you sure? 60
Yes.
seconds is still your 60. Okay, with this, we will lock option number D. Hamza, please lock option D. Oh, anyway, no worries, warriors. Okay, with this, Stallions, please ask your last question.
This patient intends to undergo elective surgery 1 year post coronary stenting. What is the correct advice you should give this patient regarding interruption, discontinuation of ticagrelor? Ticagrelor can be safely continued without an increased risk of major bleeding. Ticagrelor can be stopped.
Option number B. Yes, option number B. Yes, go ahead.
Obviously, sir. Ticagrelor can be stopped 5 days prior to the surgery. Option C. Ticagrelor can be permanently stopped. Option D. Having rapid onset of action. Withholding ticagrelor 24 hours prior to the surgery is fine. Option E. Ticagrelor can be stopped 7 days prior to the surgery.
Okay, warriors, your time starts now.
Sir, option B. Option B.
Okay, warriors, are you sure? Because you still have 65 seconds left.
Yes, sir. Option B, sir. 1 year.
Okay, with your permission, Hamza, please lock option B. Please lock option B, Hamza. Ah, seems to be a right answer. Very good, very good. Very good, warriors. Congratulations. Stallions, not to be worried, you still have a whole world in front of you. So it's just a small game. Thank you very much, both teams. Please stay with us. And with this, I will move towards Dr. Tariq Farman. As I said, he's chairman of Dow University Health Sciences Cardiology Department. Dr. Tariq, please your comments about the game up till now. Over to you, Dr. Tariq. Dr. Tariq, are you hearing? Can you listen to me? No, we cannot able to hear you, Dr. Tariq. I think you're mute or something. Okay, I will ask my technical team to just correct the issue, and with this, for time being, I will move towards Professor 𝐒𝐚𝐫 to get his valuable comments.
Thank you, Asher. Thank you for your patience, and thank you for conducting it so nicely, despite some technical difficulties to begin with. I've been sitting here since morning because we had two meetings, one at Bourbon, one this one, and I'm very grateful to Hamza and his team for organizing yet another match today. I think both the teams came from Peshawar, and they were both very learned doctors, and they played their inning very well. The questions were very good. I must admit that whoever has formulated, gone through them, and the questions were very practical and day-to-day practice related. So I think that's a good compliment for them. Obviously, one team wins, the other loses, but that doesn't mean that the other team is deficient. They just need to work a little bit more and be a bit more lucky next time. So I think we have surpassed our normal time today. Well, one thing I would like to ask Hamza, that please let the teams know that if there's a person who is not present on that occasion, then they should play with the same number of team, because it is their fault. I mean, if somebody doesn't come, the other team should not be penalized. So it's up to them to bring the whole team. And if a person of the team has some problem, they should inform beforehand. And if they are not coming, then the other team should survive with their numbers as it is. So I think we should make this clear, because this is not fair that you drop your patient, your member, because of your personal reasons, and then the other team should also suffer, and he should drop their person who may be very useful to them. So I think with this, if Tariq is unmuted, Tariq, can we hear you?
Yes, it's really nice, Professor 𝐒𝐚𝐫, your valuable comments. Yeah, I just saw the message from Dr. Tariq Farman. He really appreciated us. I think he is unable to correct his issue with the voice. Dr. Tariq, are you hearing us? We saw your messages, and thank you very much for your valuable comments. And next time, hopefully, we will try to connect you properly. With this.
And let me just say my best regards to all the members of both the teams coming from Peshawar, my hometown, where I was born and brought up and studied. My fond memories of 𝐒𝐞𝐫 and अंदर शहर.
Yes, sir. Yes, sir. मैं आपके चेहरे पे स्माइल देख रहा हूँ. जाहिर बात है, अपना होमटाउन देख के इंसान जो है वो मुस्कुराता है.
That's right.
सर, मैं सोच रहा था जब ये लड़के डिस्कस कर रहे थे आपस में इन पश्तो, मैं ये सोच रहा था कि आप उसको कितना एंजॉय कर रहे होंगे, क्योंकि I cannot understand what they were discussing because I'm from Karachi.
And I recently visited the Peshawar Institute of Cardiology, where my friend Shakar is the director. I was really impressed with the work they're doing, and mashallah is coming up as a very active and dynamic institute. HMC is also a very well-established department with Dr. Zaid Aslam Awam there for a long time. So so I think Peshawar is doing very well cardiology-wise. We have got a number of centers there, RMI, Northwest. So
पेशावर हमारे बहुत करीब है. अभी
पेशावर वाले जो है दिल वाले हैं, तो दिल का इलाज भी करते हैं, दिल देते भी है और लेते भी है.
हाँ सर, दिल का इलाज भी करते हैं, और दिल के लिए मेरा ख्याल है कि वो एक जो कहना चाहिए, अच्छी जड़ी बूटियां भी देते हैं. I visited last time Peshawar last year and they gave me very good कहवा की पत्तियां दी थी उन्होंने मुझे वहां से. So I really enjoyed my visit in Peshawar. Anyway, sir, with your permission, can we off? I would like to thank both teams, PIC Warriors and also and HMC Stallions as well. Yes, Hamza. Hamza, can you listen to me?
जी sir, sorry for interruption.
Okay, so I'm going to move again towards Professor Ishaq Saab to get his final permission to off today's proceeding. Professor Ishaq Saab, please.
Thank you, Ashar. Thank you very much. And once again, greetings to all the members, both the teams, and keep it up. Well done.
Thank you, sir.
And this was a friendly match. There's no opponents. I mean, they're all colleagues there. And some of them may come to me in the exam. We'll meet them there. So I think with this, Hamza, thank you very much. And all the Peshawar members, congratulations once again. And
Thank you, sir.
Allah Hafiz. And give my regards to Professor Shakar and
Thank you, sir.
Professor Zaid Aslam Awan. Both are my friends, and we have enjoyed very good time together at various places. Allah Hafiz, and thank you.
Thank you very much, Professor Ishaq Saab. With this, I just want to add, Hamza, one thing for both of my Peshawarites, that we are trying to, change our format for this CSL next time, like we improved in PSL as well each year. So we'll inshallah will improve this game and series for the next year. You guys will see. So anyway, congratulations who wins the game today, and good luck for the future. With this, I will off. Hamza, thank you very much. Please off the game now. Thank you.
Sir, congratulations to PIC Warriors and for winning this match. And I'm extremely thankful to all the team members and the panelists and senior faculty member, Professor Ishaq, Professor Tariq Farman, and Dr. Ashar Belalsa for moderating this session. And with this, see you next week for the match number 9. And I'm signing off. Allah Hafiz and take care.